Hello. Today we are focusing on rheumatoid arthritis. So this is going to be a case study based model, and as we have seen it in the last chapter, that osteoarthritis is one of the way that cartilage gets damaged, but this one is like an autoimmune attack, and I'm gonna give you some insights about it so that it will be very easy for solving the case study which is provided as an assignment. So this video will give you an insight about how the rheumatoid arthritis can be found in an early stage, and it can give you an observance on how we can able to come out of it, and we can give some innovative solutions regarding it. So the rheumatoid arthritis is something like an autoimmune origin disease which are treating the threats as mistakenly and launching an inflammatory attacks even against a healthy tissue. So this is not as like we have seen it in the last chapter. It is kind of an attacking the good cells which are mistakenly been attacked, and it is like a systemic inflammation because it's going to be a widespread joint damage across multiple areas, which often gives an symmetrical view of isolated joints and variable onset. So it can develop at any age. So usually if you see in osteoarthritis model, usually it attacks the people those who are having very less bone density, and it will be attacking a people especially after 40 or 45 years of age in the older age. But this one is like on a variable onset which will not have any kind of a proper answers for it, because it can attack at and develop at any age with frequent onset in the middle age also, which will be progressing rapidly over weeks or months rather than years, as you see it in the osteoarthritis. Because in osteoarthritis, the cartilage will always be the victim to get damaged, but this one quite feel different about it. And the fourth one is like systemic symptoms. So where if you see like it is accompanied by fatigue, and if you see as a fatigue, usually when the people those who are having as a problem, those who are having like rheumatoid arthritis, they will undergo fatigue in matters with respect to everyday activity. If you see, especially in the morning, if you go and have a case on this, the patient, those who are having this problem will always tell like for at least half an hour to 1 hour early in the morning, there'll be a stiffness in the fingers, between the fingers, which will make them hard to do any kind of activities with respect to that. And sometimes it is accompanied by fever also, because this autoimmune attack, which obviously will lead to the particular inflammation, which will lead to fever, and general malaise beyond localized joint pain, and stiffness will also be happen, and the blisters will also be formed between the bone and joints and the wrist. So this is a model that we are going to focus today. So with respect to this, like I have made some kind of comparison chart between the osteoarthritis and the rheumatoid arthritis. So if you see the nature, it is like degenerative, localized wear and tear, and in the nature of this one is going to be like autoimmune systematic inflammation, and in the target, cartilage breakdown will happen, and here it is like synovial lining attack will happen. So onset is gradual. It is like gradually it happens in a year, and this one is like week, and probably in a month it will develop. And the stiffness, it is going to be like activity related. When we get engaged in a particular activity, we might feel it, but when it comes to the stiffness level of the rheumatoid arthritis, it is something like if you are not moving the particular joint for a period of time, like let's say like greater than 1 hour, and obviously this will have an impact, and pattern is going to be asymmetric, and weight bearing joints will be a patterns here, and in this particular model the pattern is going to be like symmetry multiple joint. So now I just wanted to show you the case that I have focused. Let me just open it for you. So this is the case that I have given it here, And if you see, I'll just read it out. A 52-year-old patient with rheumatoid arthritis present with chronic joint pain, swelling and deformities in the finger and wrist, leading to difficulty in performing daily activities such as gripping object, because most probably these kind of people will always have the problem with the gripping objects, writing and buttoning clothes. And clinical evaluation shows reduced range of motion, that is the ROM is very important in these kind of cases, and decreased grip strength and joint instability. So as a rehabilitation engineer, so we ourselves has to empathize ourselves as an engineer tasked to develop a solution to improve the patient's hand functions and quality of life. So you have to do it in a way of design thinking model. So we will segregate the system like empathy, define and ideate. So in empathy, I want you to understand the factor that why we are facing this problem in terms of the rheumatoid arthritis person. Put in yourself in their shoes and think like what are all the problems. So collect some problems with respect to that empathy statement of those people. Once you find once you found out the reasons behind it, then we need to define the factor that what is the exact problem statement that we wanted to design, and that has to be given here. And in ideation path, you can give me a number of solutions for a single problem. So one solution should be on the top, which is going to be like a statement like how we are going to approach this as a problem. So I just wanted to give some more insight about it, so you can make it as a key so that you can work it out easily. The first one is about you can conduct some kind of an statistics with respect to the daily observance of these kind of people you will easily come across. So I can give you some kind of questionnaires which can give you an answer for it. So ask them like how they feel the pain, and like how does or how often it happens and how they feel it, and think of the fear factor behind it to do some daily activity. So these are like tiny points that we need to take care of it. And clinical limitations, that maybe sometimes the grip strength might not be there, or the joint stiffness is going to be like different from each and every individual, and limited range of motion is always there with those kind of people. So once you are done with the empathy part, go to the define. So in the define, you need to specify like how the gripping happens, or like what is the problem behind it, the design requirement, exact problem statement, all should be explained in the statement here. But make sure when you define the case, it has to be like a single sentence instead of having like a paragraph or like bulletin points. I want it in a form of a problem statement in a single statement. So exactly if you define it, so the ideation part becomes very easy here with explaining that. Okay. And when it comes to the ideation part, I just wanted to add some keywords here, like when you create a solution for it, or when you are designing a solutions for it, the first point that you should have it in your mind is ergonomic hand orthotics, or like ergonomic design model. So it should be like compounding the activity of the particular individual, those who are having this as an issue. It should not be problem to the people, those who are using it, because most of the orthotics, if you see, once it is like developed, when the people are trying to use it, they feel very difficult in utilizing them. So just keep it in mind. And the next one is like adaptive grip tools, what you are going to suggest you should mention. And then you can give me some kind of techniques, like what kind of exercises can be given to improve those kind of cases, like normal exercises, therapeutic exercises. And you can specify like what kind of compression models we can able to give them, like what kind of support gloves we can give them, because usually these support gloves are in the market these days. But give me something in a different way. And there is another way to approach this as like smart assist glove, which is coming under this HAL model in the recent years. And it's one of the most advanced model when it comes to the hand gripping techniques development, and most of the doctors are suggesting it. And I had seen it in the recent research that even cost effective model these days are arising all over the world. And since this is a case study, we are stopping it here, but in the ideation part itself, you can give me a prototype, how it can be made, like a block diagram stuffs and things, and limitations with respect to the design model that might we are going to create in the near future. And you can give me like also you can give me like what kind of materials can be used under the ideation part. And like in for testing process, as of now, since we cannot able to do the prototype for assignment level, we can just wind it up here. But as to conclude this, we need to do the testing also. So this is like a verdict, and some key points to address this as an issue. So work it out, and utilizing the notes, try to solve this. And if you are having any kind of doubts, you can approach me during the class hours also. Thank you.